Preventing Burns in Children by Jen Johnson. Our goal for this discussion is for parents to be able to identify hazards in the home that can cause burns in infants, toddlers, school-aged children, and adolescents, and for parents to know how to respond emergently. In order to obtain this goal, today we are going to discuss the common causes of household burns in children, ways to prevent burns in children, and emergency action for parents to take if a burn is to occur. A burn is defined as an injury to the skin caused by extreme heat sources, exposure to cold, chemicals, electricity, or radiation. Most burns are preventable. Preventing burns in infants. Bath safety. Parents are recommended to lower their water heater temperature to 49 degrees Celsius or 120 degrees Fahrenheit. This is recommended by utility companies, burn treatment centers, as well as medical personnel. This is because a child's delicate skin can be scalded within 5 seconds if the water temperature is 140 degrees Fahrenheit. By lowering the maximum water temperature, you decrease the chance of your child being seriously burned by hot water. You can also install an anti-scald device if you cannot actually control your own water temperature, such as if you live in an apartment, and this can easily be installed by yourself or a plumber, and it's pretty inexpensive. You also do not want to bathe your infant in the sink, especially if the dishwasher is running. What can happen is if the garbage disposal is occluded with food, it can cause draining dishwater from the dishwasher to back up into the sink, and this water is usually the maximum temperature of the water heater, so that could be 120 degrees Fahrenheit or even higher. Do not heat infants' food, formula, or milk in the microwave. The food, formula, or milk can be warmed unevenly, and there could be hot pockets within that food or formula which can burn the baby's mouth. Pouring hot liquids or hot oil should be avoided when there are children around. Hanging tablecloths can also be a hazard. If you have to use tablecloths, you want to make sure it's out of the child's reach so they can't pull on it and spill hot food and drinks on themselves. Because babies have such delicate skin, sun protection is very important. For infants under 6 months of age, they should be kept out of the sun as much as possible. Sunscreen can be too harsh for infants under 6 months old, so you could use umbrellas, hats, or anything to keep them from getting too much sun on their skin. Infants are very curious, so part of childproofing your home should include covering electrical outlets with protective plastic caps, and this can keep the child from sticking objects such as bobby pins or even fingers or silverware into the electrical outlets and causing an electrical burn. If you have a fireplace in your home, it should have a guard or a screen or some sort of gate to protect the child from getting too close to the flames or from actually getting into the fireplace. If you're using a portable heater, it should be on a high surface out of the child's reach. Cigarettes should be kept away from children. Lit candles, incense, all of these things should be out of reach. If there is a smoking adult near the infant, they should not be holding the infant, as there is a risk of the falling ashes from the cigarettes getting into the infant's eyes and causing some pretty serious burns. You should check the tags on your infant's sleepwear and make sure that you're dressing them in flame retardant sleepwear. Most sleepwear that you'll find in the store will be flame retardant, but if your child is sleeping in, say, an oversized cotton t-shirt and pants, this may not be flame retardant. Infant car seats can be a burn hazard, especially in Arizona. So always, before you put your infant or child into the car seat, you want to check the surface temperature and make sure it's not too hot. If you're parking your car outside in the heat for long periods of time, you can hide the metal parts of the seatbelt with blankets or tuck it into the seat, or cover the seat with towels or anything to keep the sunlight from absorbing into the metal, vinyl, or plastic. Preventing burns in toddlers. Kitchen safety. You want to turn the pot handles of hot pots towards the back of the stove. As an extra precaution, you can cook on the back burners of the stovetop. Electrical appliances should be kept towards the back of the counter and out of the toddler's reach. Again, you should have gates or guardrails to block off fireplaces or radiators. Matches and lighters should be stored in a locked or inaccessible area, not just put out of reach. A toddler is able to stack furniture and try to get objects they want, so if they see a lighter, they can find a way to climb up furniture and get it. So it's a good idea to keep it completely out of sight and possibly even locked away. Again, tablecloths should be kept out of the child's reach. Electric cords should be also out of the child's reach. Curling irons, flat irons, clothing irons, or any appliances that are made to get really hot should be turned off if they're not in use and unplugged. If they are in use, the use should be supervised and children should be kept away from those objects. Hopefully by now you've already lowered your water heater temperature to 120 degrees Fahrenheit. And before you place your child in a bathtub, you always want to check the water temperature with your elbow to make sure it's not too hot. Toddlers should not be allowed to play with faucets as they could accidentally burn themselves. And always, always, always supervise your toddler in the bathtub. Use sunscreen when your toddler is outside, especially in Arizona. You want to prevent any sunburns. Oven doors should be closed when the oven is on or cooking. Do not smoke, cook, or drink hot liquids when there are children that are physically close. And smoke detectors in the home should be installed and properly functioning. Preventing burns in the school-aged child. Teach your child safe behavior around hazards such as high-tension wires. You want to keep your child from climbing or flying kites around high-tension wires, as this could cause electrical burns. Teach your child what to do in the event of a house fire. Plan a safe meeting place for your family outside of the home. Teach your child to crawl to escape below the smoke. And teach your child to stop, drop, and roll. So if their clothing were to catch on fire, to lay down and slowly roll to extinguish the flames. Many school-aged children begin to learn how to cook. So you want to make sure they're safe while they're doing this by using low heat, avoiding any frying, being careful of burns from steam, scald, or exploding foods from the microwave, and always supervise your children in the kitchen. Preventing burns in the adolescent. Reinforce safe behavior from burn hazards such as gasoline, electrical wires, and fires. Advise your child to protect themselves from ultraviolet burns from outdoor sunlight rays as well as tanning booths, which can be pretty popular with teenage girls. You want to encourage the use of sunscreen, especially in Arizona, and discourage smoking. Now that we've discussed possible causes for burns, we will talk about how to treat these burns. First-degree burns involve damage to just the top layer of skin. It could be from a sunburn or a scald from steam or a hot water vaporizer. First-degree burns heal in about 3 to 6 days. The top layer of skin over the burn may peel in about 1 to 2 days. The skin will be pink or red. There will be no loss of feeling, no nerve damage, minor pain, minor swelling, no blistering, and no scarring. Second-degree burns involve damage to the skin layers beneath the top layer, and they can be caused by very hot water from a bathtub, boiling water on a stove, very hot coffee or tea, or also a flash fire from a stove flare-up, or a very severe sunburn. Second-degree burns should heal in about 1 to 3 weeks, and sometimes longer. The skin will usually blister and it might ooze. It will be pink and tender, and there will be a little bit of swelling. It usually does not leave a scar. Third-degree burns involve damage to all layers of the skin plus the underlying tissue. It can be caused by a scald from a hot grease flame, hot objects such as a barbecue grill, or electricity. Third-degree burns will blister. The skin may become a charred black color, leathery, waxy white, or brown. The nerve endings can be damaged with a resulting loss of feeling. Scars will occur and skin usually requires grafting. Deep second and third degree burns are considered full-thickness burns and are likely to require skin grafts, which is a transplantation of healthy skin over the damaged skin to help it heal. So what can you do as a parent to treat your child in case they suffer from a burn? First of all, you want to stop the burning process by applying cool water to the burn or hold the burned area under cool running water. You do not want to use ice as this will damage the skin further. If there are blisters, you don't want to disturb them as this could lead to an infection. You don't want to apply anything to the wound. This could also lead to infection. You want to cover it with a clean cloth if there's chance of having the wound contaminated. You want to remove any burned clothing or jewelry that could possibly become restricted if there is swelling. If there is any skin that's stuck to the wound, you don't want to peel this off. However, if your child is suffering from a major burn, you need to call for medical assistance. A burned area as large as 2 to 3 inches in diameter, even if it seems minor, or a burn that appears to cover more than 10% of the body would be considered major, and you need to call for help and have your child transported to ER. You need to make sure that the burning process has been stopped. If your child suffered from flame burns, you want to smother the flame or have the child stop, drop, and roll to extinguish the flames. And check your child's breathing and make sure they have a clear airway. If they're not breathing, you need to begin mouth-to-mouth resuscitation until help arrives. Burned clothing and jewelry needs to be removed as the jewelry can help conduct more heat and cause damage, and clothes can become restrictive if swelling occurs. Do not remove clothing that is stuck to the skin. Cover the wound with a clean cloth. Keep the victim warm. Have them transported to ER and medical staff will take over. Begin IV therapy and oxygen therapy to keep child from going into shock. Second or third degree burns on the face, hands, feet, and genitalia require a trip to the ER. There are many nerve endings in these areas that can be damaged, and swelling in the throat of the face and neck can cause the child to have trouble breathing, and this will be life-threatening. Also, if your child suffers from an electrical burn, from an electrical outlet socket, or from a wire, this can cause heart damage and also requires medical attention. If it is a chemical burn that your child is suffering from, you need to continuously flush the area with large amounts of water until transportation has arrived to bring your child to the medical facility. If it's a powder chemical, you don't want to add water as this will spread the chemical and it should be brushed off if possible. Jewelry should be removed to eliminate the transfer of heat from metal and constriction that will result from the swelling. Here are some things that you do not want to do if your child suffers from a burn. You don't want to apply ice, ice packs, or very cold water as this can damage the tissue more and decrease your child's body temperature and possibly cause shock. You don't want to use anything on the burned skin such as butter, petroleum jelly, or skin cream. This will slow healing and increases the risk for infection. If your child is suffering from a chemical burn, you don't want to add another burn to try to neutralize the effects, as this can burn the skin further. You don't want to use cotton balls or adhesive dressings, as this can stick and cause infection. And if there are blisters, keep them intact if possible. If they are broken, this can lead to higher chances of infection. So parents, hopefully this video has helped you be able to identify hazards in the home that can cause burns in infants, toddlers, school-aged children, and adolescents. And now you know how to respond to burn emergencies.